I think that one thing that we all have to agree on is that health reform is necessary. We all want every means possible to take better care of our patients. That's why we went to medical school. That's why we get up every single morning. But it is not a process that's going to end no matter what Congress does. We are going to continue to need to have that conversation amongst ourselves, amongst our state legislators and our federal legislators.
Right now, I'm not quite sure what to think. And I think a lot of doctors really don't know what to think at this point.
Currently, there's a lot of things up in the air in D.C. I'm not sure if the government knows exactly where everything will go, and I don't think the medical community knows where everything will go. I'm watching it closely.
When I talk about health reform, there's a story that I always sort of feel the need to tell, because I think very few people in health reform can point to the exact moment when they became very, very interested in health reform. Before I moved to Sacramento, I lived down here. I lived in Long Beach. I was in a car accident one morning, a minor fender bender. My car was totaled, but I walked away just fine. When my car got towed to the body shop, the guys at the body shop said, well, you need to go and see a doctor today. I was all of 22 years old at the time, and like, see a doctor? I never go, nothing's wrong with me. I walked away, I'm not going to go to the doctor. And they badgered me until I decided to go. I called my health plan. I won't name the health plan, but I called them and I said, okay, so I was in a car accident, what do I do? And they said, well, you have to go to the emergency room. I really didn't want to go to the emergency room because I didn't feel like I had an emergency. So I walk into the emergency room already feeling like I don't belong there. And there's a gentleman sitting in the emergency room. He's got this hand up in the air, and it's all bandaged up. He has the pointer finger from this hand in this hand. Now, you're all doctors. You probably see worse things than that every day. That still, this moment, is the worst thing I've ever seen. And he's telling the gentleman next to him about an unfortunate incident with a table saw. So I walk up to the admissions person, and she says, why are you here? And I said, I was in a car accident. They told me I had to come here, so I'm here. I said, but please, would you help him first? Like, I will actually sit and gladly wait in the waiting room if you will help finger guy. But of course they didn't. The nurse comes out a few minutes later and says, Mr. Ford, will you come on back? I said, well, what about finger guy? There's nothing, he's holding his finger. And it was that point I decided there's something wrong. And it's ever since then that I've been interested in health reform. So with that backdrop and my interest in it, let's talk a little bit about health reform. I don't think I have to tell any of the people in the room anything that's on this slide. There's some obvious problems with the way we deliver health care in this country right now.